Hello, everyone. I'm Daniele Magalhães. I'm the Senior Project Director at the Global Consortium on Climate and Health Education. And it's my pleasure to welcome you today to our final Learning Collaborative webinar of the year. And if this is your first time, we have simultaneous interpretation in Spanish, and you can select it in the globe in the bottom of your screen. And today we will have two special guests to speaking about how the curriculum on veterinary course was included, and also how was the challenges and they are experiencing of incorporate climate change in their curriculum. So we will have the Colorado State University College of Veterinary Medicine and Biomedical Sciences, the University of Pennsylvania School of Veterinary Medicine, and then at the end we'll have a space where you can put your questions, and we are going to have a final discussion. So today, we have Dr. Colin Duncan, who is a professor of pathology in the Department of Microbiology, Immunology, and Pathology at Colorado State University College of Veterinary Medicine and Biomedical Science. And Dr. Andrew Hoffman, Gilbert Kahn Dean of Veterinary Medicine, Professor of Large Animal Medicine at the University of Pennsylvania School of Veterinary Medicine. So I will give the floor first to Dr. Duncan so she can share with us her experience. Dr. Duncan, the floor is yours.
Great, thank you. Hi, I'm Colleen. I know that this camera is in a big room, and I'm joined here by our two sustainability residents at CSU. So we've got Danny up here in the front and Caroline as well. And as I go through this presentation, let's see, hopefully you can see my slides perhaps. Any confirmation on that? Thumbs up?
Yeah,
then...
we can see
okay.
it.
Okay, excellent. Okay, so I'm going to talk today a little bit about our CSU perspective and what we've done here. Just as a bit of background, because I have not been able to join any of these working sessions in the past, I wasn't really sure on what level or where everybody was joining from. So I wanted to just begin really briefly by talking a little bit about the scope of veterinary medical education that I'm thinking about or talking about during this presentation. So here at CSU, we are our program is a 4-year program, I think consistent with several around the world. There is some variability in length. Our students do tend to join us after having done an undergraduate degree, which could be in a variety of fields. And the focus of my talk today, and maybe we can chat a little bit more at the end, is probably on this core veterinary medical education. So these 4 years, or maybe what it looks like at other schools, 5 years or 6 years. During this time, students are exposed to health and disease issues in all species of domestic animals, and at some schools, wildlife. So it's a really broad-based education. But the information and sort of how we've been thinking about infusing sustainability and climate education into the DVM curriculum also creates opportunities or gets us thinking about what about those that have already trained, that are already veterinarians, or perhaps are animal health professionals in a different role than veterinarians. So thinking about veterinary technicians and things like that. Also thinking about what graduate training in this area looks like is something that we've been thinking about. So although I'm going to focus a little bit more on sort of the core veterinary experience and education at universities, please recognize that we see opportunities for educational offerings in really all of these different aspects of veterinary medicine. I also just wanted to begin a little bit by sharing some of the work that's been done here at CSU. And I'd also like to highlight that this has largely been work done by students. So these are a few projects and papers that some of our students have worked on, our veterinary students, in the course of their programs, largely through either elective opportunities or things like summer educational offerings or research programs. And this collective body of work, which was largely survey-based, really highlights that sustainability education is desired. We've surveyed veterinary students, graduate veterinarians, and also even clients of small animal veterinary practices. And collectively, all of this work really builds a case that students, veterinarians want to know about how climate impacts animal health. They believe it impacts health. They want to do something about it. They want to be part of the solution. And veterinary clients want their veterinarian to be knowledgeable about how climate may impact their pet's health. So we've spent sort of the first few years of doing work in this space was really trying to build out or understand the need and the gaps. So I think that amongst the animal health community, there really is strong consensus that there's an interest in this topic and that it's certainly relevant to the health of animals. This work and some of the other projects that we've done have also highlighted that sustainability education in veterinary medical schools and also in teaching hospitals is missing. So we did some work specifically within our teaching hospitals, not just focusing on like, what about didactic curricular type education, but are you seeing best practices in sustainability or climate responsibility in the sort of foundational learning experience, this culminating learning educational experience, which is the teaching hospital that you spend for veterinarians usually at least 1 year within. And so this article on the left-hand side really highlighted, this was a survey of many AAVMC accredited veterinary schools that had a teaching hospital, kind of highlighted across the board that, you know, in addition to gaps in didactic training, there's also a lack of seeing the best practices being implemented within these teaching hospitals. And on the right-hand side, for anybody who's not aware of this initiative, the Planetary Health Report Card, which began with purely medical schools and has now branched into a lot of the other allied health services, has also been modified for veterinary medical programs. And you can access the CSU was one of the 3 first pilot schools. This is a student-led initiative where they can kind of evaluate the school program or the educational program with respect to sort of a structured assessment tool. This looks at both curricular offerings, but also experiential learnings and climate action taken on the part of the school. And this also really highlighted that there are a lot of opportunities to fill some of these gaps in what is framed as planetary health by this PHRC group. So collectively, I think there's a really strong case for climate action in the veterinary profession. And I'll also say that we are so appreciative of groups like this who have gone forward faster, perhaps, than the veterinary profession. We've really leaned on a lot of these existing frameworks to help inform what we should do in veterinary medical education. So the National Academy's report was really helpful about just thinking about how we could infuse sustainability in all programs. And we kind of spent a lot of time in that document thinking about how this applies to vet med. Obviously, the GCCHE Climate and Health Core Concepts for Health Professionals has been so important and so informing, but also other allied services, so like the public health community and frameworks that have been created in that space. So very briefly, I just want to talk, I should mention beforehand, we've also taken a lot of information and sort of wisdom and appreciate the work done by groups outside of academia. So for example, in veterinary medicine, there's a group out of the UK called Vet Sustain, who actually developed these veterinary sustainability goals. So this is broader than climate, and I've just listed the 6 here, which they have mapped to the United Nations Sustainability Goals. But they did this work, I think this was back in 1999, where they really also thought through what is a veterinarian's role in some of these broader sustainability issues. And that framework has really been helpful for us here at CSU to inform some of our curricular work, and also projects and initiatives that we should practice, not just teach in the classroom. So it's not only climate action, net zero warming. Waste is a big issue in hospitals, as we all know, fresh water and accessible water. But for veterinarians especially, thinking about things like how we protect natural ecosystems and provide habitat for wildlife and sort of the confluence of the biodiversity crisis, general sort of preventative medicine and animal welfare, and how does that integrate in sustainability? And finally, thinking about the health and well-being of our people and our profession, as well as those who are champions or caregivers for all species of animals, and how important that is to connect that human element. So what we've done, and this is an article that's actually now in press in the Journal of Veterinary Medical Education. And this was done in collaboration with other colleagues from other institutions. So Will Sander and Amanda Berrien are the 2 other co-authors on this. But we've really leaned into several of those educational frameworks, and also really thought about, other informing resources in veterinary medical education, and come up with these kind of core domains or critical domains for veterinarians to work and to be knowledgeable about. And we're really using this to shape some of our educational offerings. And just in the interest of time, I'm just going to highlight or go over this really, really briefly. But the big 4 domains are obviously how do we manage animals in a changing climate, and so how do we address all of these climate-associated health issues, air pollution, vector-borne diseases, all the things. Making sure people are trained and know how to both ideally try to prevent, mitigate some of these things, but also provide services in times of things like climate-associated disasters. Much like human hospitals, we need to ensure that veterinary facilities and veterinary systems are resilient to the impacts of climate change themselves. There are so many images of flooded human healthcare facilities, but you can find exactly the same thing after natural disasters where floods or storms make it impossible to operate a veterinary hospital. Thinking about how, we can be responsive and still maintain a continuum of care during those times, and that our systems, not just with the primary care provided, but also how do we maintain our surveillance systems and our reporting systems, our diagnostic systems, things like that in the face of climate threats. Obviously, a really huge one in the bottom left there is the mitigation of veterinary-related climate hazards. And that's this concept of our own footprint, right? We know that the healthcare industry is resource intensive, and veterinary healthcare is no different. We use the same types of materials. We are heavily dependent on energy and water use. And how can we do better and provide care in the least harmful way? And the final one is this idea of how should veterinarians or animal health professionals engage on broader community activities. So communicating about the health impacts, about climate change, driving climate action in our networks, in our communities, and even more broadly, ensuring that there is sort of an animal health voice in these discussions. So those are the big 4 domains, and you can see here they're linked by these 2, we've called them the golden threads. Going horizontally there is foundational knowledge. So obviously we can only teach these things or inform on these domains if there's sort of a base level of foundational knowledge, whether that's on climate literacy, but also things like just physiology and medicine in general. All of our trainees have to have some level of foundational knowledge upon which to build these this additional climate curriculum. And then running vertically is this idea of continuous learning, which is that, see previous point, in veterinary medicine, we didn't have a framework for, what we should teach. And we're constantly learning new things about how another species might be impacted by climate or in a new way, right? So this is such a rapidly evolving area of science. And I think as just being aware that we're going to have to continually modify this and update this, and it will be a continuous learning. You're not going to graduate from vet school with some climate education that remains static. So how can we capitalize on all the great science that's coming out and opportunities to ensure people are lifelong learners in this space? So I'm just going to really briefly finish up by talking about some of the things we're doing here at CSU and how we've kind of framed out or been thinking through some of our climate curricula, which more broadly we're referring to as a veterinary sustainability curricula. And I use this pyramid just kind of as an example about how we're thinking about sequencing our education, and beginning really with the bottom of the pyramid, obviously being the broadest, so something that's available to everybody, building up into what might become less and less people and more specialized. So fundamental to this, I think, is modeling best practices, right? Back to this idea of the veterinary teaching hospital, the buildings in which we learn, in which we work, in which we spend a huge proportion of our awake hours. By modeling the best practices and immersing trainees in these environments that are themselves sort of best practices, that's actually we've believed to be one of the most important things in terms of trainees and experiential learning. So we're extremely fortunate here at CSU in that we've broken ground on a new veterinary health complex, and we have some amazing leadership who is committed to this hospital will be LEED Gold certified, and we're also pursuing WELL certification, which is a third-party well-being certification that also has some environmental credentials built in. We're also transitioning a lot of our laboratory programs to this My Green Labs, Green Lab certification, ensuring that all of, especially our DVM trainees, when they receive funding from the college to learn about doing research, they are all MGL ambassadors, and sort of infusing these sort of best practices into our hospitals, into our laboratory systems. I'm not going to go into this in detail, but I will say that part of this was really informed. And I would recommend this to others. We did engage a professional consultancy group to help us navigate this in terms of, we are a hospital built within a really large university system. So while, of course, we think that thinking about energy use and going to renewables is extremely important and has massive health impacts, that's like a university level decision, not something we as the hospital can do. So they really helped us work through what activities we can do internally that we have more autonomy over and more control over versus those that we really need to partner with the broader university community or Fort Collins community. So the priorities in this, which I won't go into in detail, are really thinking about what we're calling vet care without harm, which is this idea that we are providing our medical care in the hospitals, but we're doing this in the least harmful way. Obviously, this spun off healthcare without harm. And that is really that it's going to take veterinarians or animal health professionals working on coming up with their own unique solutions, because that's really different than the challenges faced by, say, the political science building over on main campus. So we need to really work to come up with some of those unique solutions. And the other thing that they flagged in this review was really the importance of connecting this to human health and well-being. And for anybody on this call that's not themselves within the veterinary profession, we've had a tumultuous time with some of our workplace well-being, veterinary professionals, and there's high turnover rates, there's high mental health issues and various things facing the profession. So really ensuring that our sustainability efforts align with our teams and our priority of our teams, and they come from our people. They're the types of things people get excited about is really important. Moving up the pyramid, beyond the places that we are embedding people is what we're teaching in the core and elective curriculum. So I've already mentioned this sort of framework that we're using for veterinary medical education. This is in the background of thinking about all that we deliver. Obviously, core curriculum is going to go to all veterinary students. What is day one ready, walk around, necessary knowledge for all? But then the students that engage in elective curriculum, that should be sort of a different experience. So what we have focused on here so far and continue to build out is really our elective curriculum becomes experiential. These students are working on projects, they are developing podcasts, they are doing research, they are writing papers, they are doing public communications, they are presenting. So it's really level up from like sort of a testable kind of multiple choice type of education. It's much more experiential because these are the folks that are choosing to learn more and want to do more. We also see great opportunity in our external rotations. Although in our own hospital, we want to make sure we are modeling best practices, we know that students go and get great experiences out in private practice. And I have on here just a couple of colleagues. Jeremy Watson down in the bottom was the first vet clinic in all of Australia to go carbon neutral. At the top, this is a VCA clinic out in California with a real climate champion, Dr. Dickon Westworth, a neurologist. It's really cool when our students go and they have external rotations in places where they see like others modeling best practices in private practice, or even research groups that are championing and working on similar things. So really being able to direct students to external rotations that help them meet their goals, and also really highlight champions that are doing great work in this space. We believe that there should be paid and supported positions for students that are doing more. So for several years, we've run this sustainability intern program, which Danny and Caroline, who are sitting in this room, who then move up the pyramid, we're both a part of, right? So these are the students that are, working on various sustainability issues within the hospital, and they're in the clinics or they're in the classrooms, they're talking about this stuff, they're engaging. They're, I think, really the best ambassadors for doing this type of work versus like the fuddy-duddy professor who sits in an office, right? So this has been really an exciting opportunity, and it's also great for these trainees who are interested. Paid work is always great in a program that costs a small fortune, but also this is, I think, good work experience in a field that has very few paid positions, right? So we've been fortunate to support these students off of some philanthropy funding, and I hope this is a program that could continue on. And finally, and this is my colleagues here sitting with me in the room, we've really thought through like, what does graduate training for veterinarians look like, and how can we ensure that our next generation of leaders are fully credentialed, fully empowered, and are developing skill sets that are helpful in this space. So the program that Danny and Caroline are doing is, we're calling them the Sustainability Residents, but they will fit in within the American College of Veterinary Preventive Medicine. They're concurrently both doing PhDs in epidemiology on air pollution, so significant climate disease. So the idea being is that, students who are interested in doing this work as a true professional program, or like in the work that they do, work exclusively within this area, that they have the skills to take on those types of positions, which might not exist with a climate title right now, but have the skill sets to work in this space that we know to be so important. So there have been lots of challenges. There will continue to be challenges. And I think the biggest are not hard for this group to understand. Time. The veterinary medical curriculum is already overstuffed. And how do you add new things? That's always a challenge, right? And so that's something we can talk about in the discussion. Happy to share where we think this is going. In addition to opening our new hospital, we are launching a radically rebuilt veterinary curriculum where climate has been planned for throughout this development. And I think we've learned a lot of lessons through those discussions. We worry a little bit about bandwidth and expertise in our educators, right? This is a group of specialists who largely deliver our program, and they say things like, I never learned about climate in school, how can I teach it? And I think that's probably no different than many of you on this call. And of course, finances is always a challenge. You want to create something new, or you want to pivot to the more expensive biodegradable gloves, or these types of things, right? And so how do you balance those sustainability needs with the economic realities, especially to, gain support of those who have to make really hard decisions in the economic space? But I will say overwhelmingly, I'm also, though, inspired by so many strengths, and the real strength comes from the people. We have great people doing important work in climate and health, including specifically veterinary medical education, which I think is wonderful. We have amazing educators that really care about getting important concepts to students, regardless of what that content is. So people who are really good at thinking through how to deliver important material in a way that's engaging, empowering, impactful, meaningful is super. And we're really fortunate to be part of an engaged community, which is like all of you on this call and the GCCHE team, where we're learning from each other and able to do these things together. In many ways, we really have taken a lot away from the human health community and the public health community and how we're navigating this. And for that, we really appreciate everybody, and I'm happy to talk about any of this stuff more in the discussion. And I will say, and I'm happy to share out this link, for any of you that are on the call, we do have a working group, the AAVMC Climate Change Working Group. Andy was going to talk a little bit more, I think, about how this got set up by the deans in this position statement. So we have shared this now with actually the deans of all AAVMC vet schools, and we encourage anybody who's excited about this topic and wants to engage more broadly on sharing of resources to sign up, and we will be in touch. So with that, I will pass the mic on, and happy to discuss any of these things after.
Thank you so much, Dr. Duncan. Very informative presentation, and I think we can detail more at the end. And I will pass it on to Dr. Hoffman to also share with us his experience. Thank you so much.
Great. Everybody can hear me okay? Okay, good, head nodding. Thank you. Well, thank you so much for having us. It's wonderful being part of this community. And I think Colleen has really been a pioneer in the veterinary education around climate and health. So I want to thank her, and as well as taking over the working group, which I will mention in part of that. I'm going to go in a little bit different direction. We're going to talk about climate and health education more generally, and then how it has been perceived in the veterinary community, in the academic community, and some new possible ways to address at least one of the challenges that Colleen brought up, which is, how we move forward and disseminate this knowledge throughout curriculum. And so I'm just going to start out and just remind everybody what we know in this moment. This is from the UN Environmental Program. It's a wonderful, just try to move that block over. This is a wonderful description of, and link to the Sustainable Development Goals, of what types of global drivers and threats are going on right now that intersect with climate. And of course, one of the things I think that we know that's most challenging, and we saw in an election year in the US, is the problem with misinformation and disinformation and declining trust and polarization in our society. And that, along with the global geopolitics that are going on right now, seem to be the biggest global drivers and threats to climate action. But I have hope, because I feel that one of the things that's evident in the literature and from our own experience is that education, particularly about public health and epidemiology, is an antidote to the spread of this misinformation, disinformation. And of course, it's an important resource to our health professionals. Climate is a health problem, and everyone on this call is probably passionate about that. One Health, which is the inextricable link between the health of animals, people, and the environment, is one such collaborative framework for graduate, professional, and of course, interprofessional education. So I guess the question is sort of, what is, One Health? So One Health is a public health framework. It's a framework for collaboration, coordination, and communication, but also it's a way of thinking through study design and policy and regulations and interactions at both the local scale and the global scale. It's a broadly accepted framework. It's been sort of accepted into the quadripartite. The One Health high-level expert panel has commented and is on its second iteration of the panel. I show the link of their publication below. I'm going to mention that in the next slide. Governments, NGOs, agencies, and of course, universities, the national academies, and countries have all brought One Health into their ethos and policies. One of the challenges with the dissemination and the broadening of how One Health is being used, it's also become a little confusing about what it is. And so that we've talked a lot, and in the veterinary schools and in the national academies about the definitions of One Health. And I don't think that's as problematic as more how people are applying One Health in real world situations, whether it's in implementing public health, vaccine programs, or addressing challenges for indigenous groups that rely on salmon during a drought, era of drought. When we're addressing those issues, we think about animals, people, and the planet, but what is included and what is excluded in those projects and in those funding and resources is a problem, as indicated in this Mumford et al. Paper. So there are significant gaps in our understanding of the scope, the approaches that people are taking, the worldview and lens that people are using, and the actual methodologies for connecting our observations and actions around animals, people, and the environment. We got together as the IHP Global Forum, or the Environmental Working Group of the National Academies, to explore the real world perspectives on One Health. And we did this because to bring One Health and connect it in with climate education, we needed to understand how people were really applying it. So I'm just going to go briefly over this survey, and this survey is going to help us inform interprofessional education on climate. So climate and interprofessional education, that's really was the goal of the working group. We felt that the One Health framework was an ideal framework for interprofessional education, but there were real serious questions about some gaps in our understanding of how it was being applied. So what we wanted to find out was, how are people using One Health? How are people applying it in their One Health agenda around the world? And so what we sought to do with the survey was to inventorize the features that people were using in their One Health work and identify gaps. And also, how well did the actual real world application of One Health in education and projects and policy and so forth align with published guidance? So we have a multiple selection question survey with open-ended questions and feedback on the survey that we put out. And it's been on for the last 3 months, and I'm just going to give you a preliminary insight into the results. I just showed you an example of a question we would ask. Each of the questions was also categorized as a domain, as a prospective domain for future curriculum in interprofessional education. And the example is sort of, which of the following drivers of health inform your scope of practice within One Health? So drivers are demographic, genetic, geographical, environmental, so on and so forth. Choose all that apply. And there were about 100 respondents as of the beginning of October. And this, of course, was put out in your newsletter and in the middle of November, and you'll have additional opportunities to answer the survey. These are all the different organizations for which we solicited participation. I'll give it 1 second if you would like to grab the survey with the QR code if you haven't had a chance to fill it out. Everyone on this call would certainly be more than welcome and encouraged to do so. I'm just going to show you some examples because there are 13 questions, therefore 13 graphs. I'm going to show you, and 13 domains. I'm going to show you 4 or 5 of them. And these are the type of results we're getting. On the y-axis is the total number of clicks, total number of selections that 100 people made of that particular choice in that particular domain. So for example, under organisms, the majority of people are working with humans, and to a lesser extent, other domestic animals like companion animals and terrestrial domestic animals. But to a much lesser extent, we see, that people are working in the domains of aquaculture and invertebrates and plants. And of course, there's certain bias that goes into these surveys. You're soliciting people that tend to work in public health. They tend to work with humans. But you get a sense that we're inventorizing the type of real world application of One Health. And in terms of environmental models, as you see below, we actually can see that ecosystems and terrestrial environmental systems are the most prevalent. There's very few people working in cryospheric environments and atmospheric biotic environments, not surprisingly. Scope of health impacts was another question that we had. What types of health impacts are you studying in your One Health agenda? Antimicrobial resistance, food security and safety, NCDs, vector-borne illnesses, waterborne and foodborne illnesses, and zoonoses. Large number of participants selecting those, which isn't surprising. Not many people working in respiratory illnesses, forced migration, malnutrition, in contrast. And I think this will be the last example I'll use of this survey. The methods that are actually used to evaluate the inextricable links, the actual connectingness between animals, people, and the environment. What type of scholarship is being employed? There's many different types of scholarship that this panel put together in the questions, but community engagement and participation, as well as sort of trans, multi, and interdisciplinary sciences were employed as models most commonly. And so we're getting a sense that and indigenous approaches were used very uncommonly. And I won't go through all the results because right now we're going to, at the end of November, pull out an updated data set, go through all of those, look at the individual responses and interactions between selections within one individual to see if there's sort of interactions between the selection of foodborne illnesses and collaborative co-production of knowledge, and to get an idea of how people actually in real time are employing the One Health agenda through their lens. And this is a word cloud of all of the data and all of the questions to get a sense of what things were answered commonly, and you can see humans in the middle, and what things were in smaller print uncommonly. And I just put up some red arrows and things that were answered more uncommonly. And I think those are of equal or greater interest than the areas of One Health that we all seem to typically fall into, which is humans, zoonoses, public health, food safety, security, and comparative and translational sciences. We see things that are uncommon, food sovereignty, indigenous approaches repeatedly in our questions were uncommonly selected. Plants, invertebrates, aquaculture, social constructs. So you can see it just gives you a real world, real perspective on what is One Health, or what is your One Health. Moving on, I'm just gonna briefly go through leadership at the veterinary colleges. The AAVMC is like the AAMC for veterinary, the veterinary space, accredited colleges. And we put together a task force, which now is a working group that's been transitioned to a working group that Colleen leads with two of her colleagues. And we early on, a couple of years ago, surveyed ourselves. This is a spreadsheet, and simply these total scores reflect how the 10 deans that were internally surveyed in the task force ranked key areas of focuses and approaches that the AAVMC should support in developing climate and sustainability and health education. So a total score, a maximum score is 20 for any of these cells. So for example, in the top left corner, the deans ranked animal health and medical consequences of climate, employing education as an approach as the most critical for the organization. But research was also considered important, and key areas of focus, many that showed up in the One Health survey as priorities: One Health, zoonoses, agriculture and food systems, disaster medicine, and climate change basic facts were considered to be priorities for veterinary schools and building out curriculum in those areas. And that's just a key focus area. Summary, we did table research because AAVMC is not really, at least in terms of resourcing research, a strong organization, but they prioritize shared educational resources. So we moved forward with that, and that turns out to be the priority for the American Association of Veterinary Medical Colleges in climate and health, in the climate and health field. These areas of focus and shared educational resources. We then surveyed the members of the AAVMC more broadly, and to see what actual resources exist in their institutions And the percentage is the percentage that people replied yes to various queries. Do you have a course dedicated to climate change? Do you have climate change content throughout the curriculum, anywhere in the curriculum? Do you have a dedicated person, an FTE, to climate change? Have you stated greenhouse gas commitments? Do you have university-wide programs, student engagement at the AAVMC related to climate change? A working group? Are you part of a working group, and do you have climate change research? And this survey went much deeper, of course, but you can see that not many veterinary colleges have courses, dedicated climate, coordinators or curriculum leaders, or statements on greenhouse gas commitments. And not many, although I know that Colorado State University has a very strong student engagement and student clubs, not many of our veterinary colleges do. So how are we going to move forward with climate and health education? Colleen's given us a really good pyramid. I love that pyramid because it's so holistic, and it shows that you can start with core curriculum and move all the way up to graduate and professional programs. So I think that's a nice model. And so where are we going to make these touch points? Well, obviously, graduate and professional courses that are dedicated to the topic of climate change, perhaps using One Health as a framework, as in this course that was recently developed at Penn Vet for our Masters in Public Health and VMD students as an elective, not a core. And you can see the sort of domains that were listed there. So traditional coursework is obviously incredibly important, and a concentrated graduate level courses are really important in the context of health education. I only have 4 more slides, so we're going to be whipping through 4 or 5 more slides. Going to be whipping through this. So this is just to show you traditional competency-based curriculum development involves, as you all know, better than I, the development of domains. Colleen showed you some really nice examples of domains that her working group are starting to advance. Learning objectives, preform content, learning experiences, capstones, labs, and so on and so forth. I'm showing you in these rectangles hypothetical domains in a climate change and health educational course that uses the One Health framework. It's just hypothetical areas that could be brought into that. The challenges with these courses is, of course, it's laborious to put a course together, as we all know. Revising and updating tends to be less frequent. The courses are obviously behind a academic paywall and firewall, and sharing content even across the curriculum can be challenging. And then as the curriculums are redesigned to be more integrated or organ system or blocked designed, there are opportunities perhaps to more efficiently introduce climate and health education at some point in that block without having to put it in every course. So Sam Goyen, who is our new climate coordinator, and I are embarking on what's an open learning platform to augment the traditional competency-based, course-based education. We call it the all-in developer model, but it really doesn't matter. This is the idea that the increments of information that are available in an open learning platform, available to everyone, are community-driven. They can be curated and then distributed incrementally. They're not within the boxes of domains, although they could be assigned domains with tags and other mechanisms and search words. They're searchable and accessible to everyone within and outside of the course. They can be brought up to date at any moment. They provide complementary support for traditional course, core and elective courses. And there are opportunities to break down the walls of domains and see connections and encourage connections and push connections across disciplines. And this is sort of the platform that we're using. Our theory of change is that this type of thing will actually have an impact on education by providing an incremental wiki system, an open learning platform that people can draw down increments of education. And so this is one of the solutions that we're working on. And we're going to be working on it such that the content is derived from the Penn academic ecosystem, but then it will broaden out from there to partners and hopefully outside academies. And we're in the process of platform development and working with developers on how that could be done. So this is just an example of something where you take an increment of information. Let's say, what's the heat tolerance of the canine species at a given humidity and temperature? Will they be relying on evaporative cooling or panting, or will panting fail? Like, for example, over 80% humidity. You know, these little increments of information that you want for your course, you want it updated, and you perhaps might want to bring it into a round scenario or into a lab or into continuing education, lifelong learning, so on and so forth. But you don't want to read the whole paper, but you want to know it's rigorous. So you take this information, if you're a content developer, you can actually produce this from your own work and input it into the open learning platform. It then circulates to, after quality control from an editorial board, it circulates, and then it can be integrated, of course, and mapped onto a variety of areas of the curriculum easily, without interfering with what is the core and elective curriculum currently. It's there to augment the information that's there and provide climate information. And then eventually it will be applied to everyday teaching and learning, dialogues, and even practice. And so that's really all I wanted to say. It's just a little bit different approach that I hope to update you in the future. And I really hope that we can partner between the Wiki and group and partner with organizations like GCCHE that we can really build out a more accelerated dissemination of climate and health education. These are just the acknowledgements, and I wanted to thank Sam and, of course, my colleagues that developed the courses, the surveys, the AAVMC group, and, of course, now the working group, Colleen, Amanda Berrien, and Will Sanders. So thanks. I'm going to stop sharing.
Thank
Hopefully
you so
that
much.
gives enough time for questions.
Yeah, we do. We have 10 minutes. Let me put everybody here. So I have a question. There are some questions here in the chat, but I have a question to Dr. Duncan. You mentioned about how was a little bit difficult to engage other professors, and they were worried because they don't know much about climate change, and I would like you to speak a little bit more about this, because I think most of the people that are thinking on incorporate a climate curriculum will deal with this barrier that other professors are not well prepared or don't feel confident to engage with this new task, and also what do you suggest, and how did you do to engage all these professors? Thank you.
Yeah, well, I wouldn't say that we have all the answers here, nor that I'm necessarily an expert in this. And I think you're spot on, is that we see this in all sectors because you know, people are specialized in their own domain and kind of come, you know, our educators in the veterinary curriculum, largely veterinarians, probably PhDs, board specialization in one particular area, and they've kind of gone down a real rigor in their education, and that's the stuff they teach. So it's like it's a heavy psychological lift to teach something that you feel like you maybe have read a couple of papers on, or you don't consider yourself a subject matter expert. I don't think it's unique to climate change. I think sometimes when we try to introduce a variety of new material or even new teaching techniques, we come across similar barriers that it's new. So I think in the conversations that I've been successful in having, I'm sure there's others on this call that have navigated the same problem. It's really, some of those best practices in science communication, encouraging people to connect it to work that they are comfortable with. So for example, like with our internal medicine folks, right? They are already thinking about how multiple body systems interact in complex ways, and they understand sort of that basic physiology and response to threats. And so really encouraging them to think about it in the context of the material that they already teach and sort of bringing it in as another factor, right? So we already have people who are experts in respiratory health, for example, and pneumonia and allergic airway disease and things like that too. And so instead of thinking about like, how do I add the topic of global climate change to my lecture on cat asthma, instead you say, no, you don't have to talk about like the global problem, but it's really just how does air pollution or any type of pollutant exacerbate like this known pathogenesis of asthma? Or how does, thermal stress has been widely studied in animals, and we understand that physiology. So encouraging people really just to think to how climate change attaches to material that they already know, and helping to make those links is helpful. I'll also say that probably several folks on this call have done similar, but in a lot of the trainings on talking about climate change, so I'm thinking about things like Al Gore's Climate Reality, there's this real focus to like normalize just talking about it using high level basic facts that people can point to because they have come out of like large organizations with robust scientific backing. So thinking about being able to point to IPCC work, World Health Organization work, those types of things, and helping our educators like maybe connect to some of those things. Even this morning, Danny and Caroline and I emailed one of our surgeons about like, here's a peer-reviewed paper on this particular topic. So I think that's also been helpful, is you have a conversation and then you follow up with like, hey, here's some resources that we think might be of interest to you given your area of expertise. So I think it's maybe that baby step of connecting it to comfort zone instead of like asking somebody to talk about something that's way out of their wheelhouse, is really just bringing this idea back that climate affects everything we do all the time, every day, and sort of starting with like a small step of connecting to your existing work versus asking people to do a Herculean leap towards material that is completely foreign.
Thank you so much. Do you have something to add, Dr. Hoffman?
Yeah, I'll just add to that. I think there has to be a core ethos at the institution that this is an important commitment. That can come through exemplary leadership in areas of climate and health education by leaders in the school, not just me, but people that are really engaged by showing that it's at the university level or an institutional level, it's valued, and that this is making really unique connections that your, in this case, veterinary school didn't have before. By engaging in this area, people start to really value that. And you start to see people, and of course you can make commitments and position statements as we've had to actually explicitly say this is a mission and a value of the school. But I think then what happens is, what's I've observed anyways, is my colleagues have observed, is the champions step up in the institution, and they start to want to see climate and health education, as Colleen says, infused throughout the curriculum, infused in their courses. And they start to be more proactive, and they start to learn and take certification. So, but I really do think you then have to provide resources. That means you have to have somebody to help coordinate some of this work and provide money and resources towards that, show a commitment. And then I think it's really important that people see that your institution really values this and is committed to addressing climate change through education. And Colleen made the observation, which I think is really true, is that your institution also has to be very committed to its operations and its greenhouse gases. And so I think, if your institution just wants to have nothing to do with it, doesn't want to put resources towards renewables, for example, that sets a really poor example, and that might even just derail people's interest. So those are the more institutional, I think, inspirations for people to get involved. And then from there, I think you need to find the champions and need to find the tools and the resources. One of the reasons we went into the wiki work was that for the reasons that you're asking, there's a lot of people that are not experts on this area, and that yet they want to map some information, some background information on herd health or reproduction or CPR or whatever, and they want to pull down small bits of information. By providing them tools like that constantly notify them of new information that are coming out that are relative to that particular lesson, we feel we'll encourage people that aren't experts to engage in the subject.
Amazing. We have a couple of questions here in Spanish. I will try to translate. Is there an estimation of species loss because of related to the increase of temperature or air pollution or water contamination or changes? Yeah, I'm trying to do my best to translate to the English.
I'll just briefly say that there has been attribution science on global increase in global temperatures, as well as ocean acidification and changes in temperature of the cryosphere and other environments. And the consideration is that we're in what might be the sixth mass extinction, and that much of it can be attributed to climate change and pollution. Deforestation is a big part of that. Desertification is a big part of that. And in terms of the actual percentages, they're very dependent on the environment and the species we're talking about. But certainly there's some very good attribution science suggesting that and confirming, I think, very, very unequivocally that climate change is contributing to species loss.
And I think it's also correlate with the picture that you show us about how people are working in different sectors, and we can see that just a few people are working with migration, for example, and indigenous people. And I think with this increment of climate change in the veterinary curriculum, many of these sectors are going to change, because migration is something important, not only to know about where are the species, but also all the species can be host of diseases and viruses that are in a equilibrium in the environment. But now, because of climate change, they will migrate to another region, and this will need to be also part of an early warning system and a surveillance system, and maybe you have other examples of how do you see that how veterinarians are going to change and with this new climate change knowledge in the future, how they can understand our other areas as more related to human health, because we saw that most of them are related to a human-centered activities. So
yeah, Colleen, do you want to?
Yeah, I mean, I think it's such a wonderful question and really appropriate for this group, right? As we think about how can animal health professionals work with public health professionals, medical professionals. So actually worked with some of our medical school colleagues up here a few weeks ago, and we talked about some of these overlaps. So for example, in the forced migration situations that you've spoken of, there's so many obvious places where animals come into play, right? So we think about communities that are dependent on animal protein and livestock as their livelihood. Can those people bring their animals with them? Do we end up having animals and people mixing in new ways because we are clustering together? We also think about even companion animals and the sort of mental health and anguish that we know to be associated with climate change. But for people who also have a close connection to animals, and those can be domestic animals and pets, but they can also be things like wildlife that people are connected to culturally or have a long history of being engaged with, right? So I think that in many of these places where we think about how climate is displacing people, many of those people are connected to animals, be they for food, for companionship, or even culturally, right? And so I think it's important that we think through that. We've learned some unfortunate lessons, even in the United States where we are, where if we don't account for animals in the planning, then people don't behave as we expect. So the classic example here in the US is Hurricane Katrina, where there was no plan to help evacuate animals out of those affected areas. And what happened was people refused to leave because they would not leave their animals, or they went back into dangerous areas to rescue animals. And so that actually led to federal legislation, the creation of the Pets Act, for sort of disaster management. So I think it's really important that we think about these close relationships between people and animals, not just always that the animals are a hazard, but also that some people take, it's critical, literally critical to their mental health and well-being, their connection with animals, and to their livelihood, economic livelihood. So I think there's many places where the health piece is much more complex than perhaps like counting number of cases of particular diseases, and the valuation of animals in that sort of how they contribute to individual and public health is really challenging to capture. So your previous discussion about wildlife and biodiversity loss, like how do you put a price on nature and literally losing all of these species, right? And what does that mean for societies is really complex and really important.
Do you want to complement Dr. Hoffman? And we are in the top of the hour. You are mute.
No, I just said that was perfect. Nothing to add to that.
Okay, so amazing discussion here. I think this panel showed the importance of bringing to the veterinary curriculum climate change aspect, but also because we also are in a biodiversity crisis, and we need to connect all this puzzles so we can give not only a better health for her, for us, but also for the animals and the biodiversity. And it's super important to include this in the curriculum of the veterinaries in the future. So thank you so much for this and amazing presentations, and see you.
Thanks for having us.
Glad to do it. Thank you so much.
All right, thank you.